Okay, we are live. Hi, everyone. Welcome back. I am Dr. Jenny Lay. We have a special guest with us today, Quiara Smith. She's an occupational therapist, specifically with pediatric patients. And so she's going to join us today talking about childhood constipation. So we tried this multiple times on Instagram, and now we're here. So hopefully it's all going to work out.
Yeah. So thank you guys for joining in on this conversation. And I wanted to reach out to Dr. Lay because I work in pediatric pelvic health. A lot of kids that I see have chronic constipation, issues with bedwetting, fecal smearing, encopresis, toileting issues, and parents are looking for alternatives to what they've been kind of provided so far. And so I kind of wanted to see, and also my followers wanted to ask some questions about how she works with kids who have chronic constipation in her experience as a doctor of osteopathy and family medicine. And so this is kind of what we were planning on doing today on Instagram, but we had another kind of pivot to you guys here on YouTube Live. So thank you so much for having me and spending the time connecting with us, Dr. Lay. Can you just kind of tell us a little bit about, because some of the followers aren't familiar with what you do or how you practice. So I would love for you just to kind of give a little intro and a short bio.
Yeah, of course. And so I'm a board certified family medicine physician with a special interest in osteopathy, doing osteopathic manipulative treatment on my patients. We think that medications is a good use in certain instances, but a lot of my patients, as yours, try to avoid that as much as possible. And so these modalities help me ease pain, ease constipation, and things like that without resorting to traditional medication and care. I think that my philosophy, or the osteopathy philosophy, is more holistic and looking at the root cause of disease, figuring out what is causing disease, as in constipation or whatnot, and treating that. Not saying that other doctors don't do that. It's just our overall philosophy in osteopathic medicine.
Yeah, wonderful. And I really like I was sharing earlier, is that my daughter, when she was born 3 years ago, we really wanted a DO to provide the care that I think just kind of resonated with how we live our life and how we look at health and wellness. And so I really, really like kind of that perspective. The followers that I have on my feed wanted to ask you a few questions about how you manage childhood constipation and what your experience has been in helping families with that. So in terms of how you typically treat, what are the things that you kind of focus on or that you find important in the interventions that you're providing to children and families?
So I think that any good doctor will start off with a very, very thorough history, because depending on how the patient presents, like the child presents to you, the treatment could be different. It's really important to see when this constipation started. Is it associated with like starting of toilet training, or has there ever been a anxiety provoking new change that occurred in their life? Parents separating, going to a new school, bullying, a lot of anxiety and depression. All these things can lead to a more functional constipation that we need to figure out. How often are they stooling? How hard is it? What is their diet like? A lot of the patients I see specifically, usually in this day and age, it is due to the diet. We are on a very fast pace. Moms and parents are expected to do all the things like home cook meals and drive them to soccer practice and just be all the things for them. And I know we can't be that. And with society now, we tend to gear more towards like processed foods. There's lots of screen time. There's not as much activity. And so we don't have as much hormones to help with peristalsis, in pushing the stool out of our system. And so learning that history and addressing those particular needs is what's more important in my practice. And I was telling people on Instagram this prior to you getting kicked off. I was saying that how in your practice, I think it's so much better because you're able to spend the time with the patients talking about all these things. Like for me, in conventional medicine, I don't feel that the healthcare system is geared towards patient care. I think that the healthcare system in the United States is geared more towards institutions and hospitals making money. And so for me, I'm in a time restraint. Like my patients get 30 minutes in an appointment, and that is a lot compared to other people. Some people get 20, some people get 15, some people even get just 10 minutes. And there is no way that we are able to get a thorough history and be able to give you the education that you need in order to change your lifestyle to make good changes. And that's where I feel like other help comes in, and that's where you would come in. I feel like our practices are very, very similar.
Yeah. And I love that because I always tell families, I'm just one piece of the puzzle, right? So like I have this special skill set that can look at the body and what's happening in a different way. But when I see the long lasting changes, it's actually because that child has a good support system from a DO like yourself, or a nurse practitioner, a nutritionist, a PT, an OT, maybe a behavior therapist. And so when there's all these people who are working on the one common, I like to say, challenge or moment of need for the child, we see better outcomes. And I know that you've seen that in your practice as well because of that holistic care. And so it is really a reality that you guys in conventional medicine as doctors only have a specific time with the patient. And it's really hard to get the full picture because of that time constraint. And in my practice, I get 60 minutes once a week. And so over time, I can see changes, but I can really understand like the root causes of certain things. And then if I don't know, then I can refer that family to someone like yourself saying, okay, well, this child has been on this specific medication and there's nothing that's changing. How else can we look at this, or how can another provider address this? And I hear it day in and day out from families, parents saying, there's no one else that can help me. Like I'm in an area that no one knows how to help my child. They just keep telling them to take Miralax and that's it. No one's helping me with like nutrition, or no one's helping me with sensory stuff, or even alternatives, like telling them, hey, there's actually other alternatives on the market that you can try. There are also natural remedies. There's also body work that you guys do with manipulation and how the body needs to become in more balance and in more harmony. And so I think just getting out there, and that was my impetus for doing like social media and stuff, is because I had this training as a pediatric pelvic floor therapist at Stanford Children's Hospital for many years. And then I branched out to my own private practice to be able to see kids longer and be able to treat them in a way that was more holistic and integrative than the conventional kind of medicine that you're in when you're in a hospital setting or a clinic setting. It really is super important to understand that there are so many different options, but the word has to get out there. The knowledge has to be shared. And people like us who are in the field that are seeing these kids day in and day out, and these families who are struggling, like we can actually be a resource, not necessarily like, oh, I'm going to see this person in my practice, but at least we can try and direct them to where they could get the best care. So that's kind of why I reached out to you. And a lot of my families are struggling. They're just struggling with finding out like other alternatives to, the typical medications. And one of the questions I received from one of the followers is, what other medications or supplements have you recommended in the past for your clients or your patients instead of Miralax for constipation?
So my I generally only do Miralax. I know there's other medications out there, but if you guys don't know, Miralax is an osmotic agent where it pulls in water into the stool, and so it helps with the stool softness to easily pass. What I actually do is teach patients about a OMT technique. Like I do it once in the clinic, and then I will have parents there with me, and I'll teach them how to do it. But I don't know if you guys can see, so I'm going to try to demonstrate it for you.
I can see. Yep.
So your intestines, your large intestines go up, across and down into the sigmoid, and that's how it goes out, right? And so in OMT, we call this the colonic sweep. And sometimes when your intestines are not moving as much, you can manually help it move. And there's like a ligament that goes this way. And so freeing that ligament and doing some things with the sympathetic and parasympathetic nervous system, it can help with the peristalsis and moving stool out. So usually I do this for adults as well. And 30 minutes later, they'll go have a bowel movement. And so I say, like, don't do this when you're out and about, do this when you're at home. And you want the child to be laying on their back and very relaxed so that they're breathing with their diaphragm. And you start off by pulling the intestines up and in a little bit, and then feeling a release, and then pushing down towards the rectum, right?
I'm doing it too while you're doing this.
Yeah, and then you pull up and then push down, and it's kind of like sweeping the stool out. And you want to start at the outlet. So starting on the left lower side and pushing down and out. And the reason why we do that is because we don't want to start at the beginning and have all the stool be backed up here, because it's going to be very painful. So you want to loosen up the end first, open up the outlet before you start pushing things out. So you start down here and you move down, you start up here, push down, you go from the side, over, down, and out, and then at the very end, go down and out. If you place your hands on the diagonal here, you can feel like that ligament, usually it's stuck up here. There's a bundle of like sympathetic, parasympathetic ganglions here. And so moving the soft tissue to help release that, or even teaching your child to breathe with their diaphragm to help move all the stool down is very beneficial, right? And so teaching them how to do that to relieve the constipation has been helpful for in the treatment aspect of it. There are other minor things that can help, like if there's a stool clump in there that's really, really tight, there's really nothing you can do besides like getting an enema. But I find that that's very traumatic for my pediatric patients, and they're not able to hold in the water for that long for the water or the enema to dissolve the stool for it to come out. So it's not as helpful as for when they are adults. Okay. And so when it becomes that bad, like I usually refer my patients to like OT, PT, and psychiatric care.
Awesome. Yeah. And I love that visceral technique. So in therapy, we call it visceral manipulation. Well, yeah, like we're helping with gut motility. So it's very similar to the ILU massage that we teach clients, but I really like your technique of actually lifting and then pushing down, because it kind of mimics, right, peristalsis, what you're trying to do, which is really nice, because I'm going to start that technique. I'm going to try it and see. I'm going to try it on my daughter first, and then I'm going to try it on my patients. So that's going to be wonderful.
Yeah, funny story. My first son, he had lots of ear infections, and so he had to get so many antibiotics. And then he had like this sensory issue, and so he didn't like to eat like a lot of foods, and he ended up gravitating to all like the processed foods, and like it's either he won't eat or he will only eat processed foods. And so he had a lot of like gut issues, constipation issues, and so this is what I would do for him, and he'd know, like every time he had a stomach ache, he's like, "Mom, you need to fix me."
I love that. And I always say, like, of course, us as providers in this field, we're going to have a child who is struggling with that. So like, yep, my 3-year-old, yeah, she's had constipation. She is kind of a selective eater as well. And so obviously that puts you more at risk for having constipation. So I always say, whoever you believe in, if it's God, goddesses, Buddha, Allah, whoever, they are saying, you have this special gift. Now I'm going to give you a child who is going to have some of these issues or troubles. And I'm like, yep, it is. And so I think, just having that as well as a provider, and then you actually like have that real life personal experience with it. And then you go to teach it, or you go to instruct, or you go to educate other parents and caregivers about it. It's like they buy into it more because you've experienced it. You know what it feels like to have a child that struggles with it. So I think that's another piece of kind of holistic care, to be able to say like, well, I actually know how that feels because I, as a mom, have experienced that too. It doesn't make it easier because you do this for a living. It's like, yeah, when it's your child, it's so different than when it's your client or when it's your patient. So that I'm happy that is going to work for most of the kids. And so another question that we had was, what are your top 3 tips to prevent constipation in children? You spoke, about movement and about a little bit of nutrition. And then is there anything else that comes to mind?
So I would say that it's really important to diversify your diet. There's multiple studies that have shown that the more variety, especially with fruits and vegetables that you have in your diet, helps with the gut microbiome. And so it will help with motility and just digestion in general. Nutrition is probably really, really key. Movement. It's hard for kids nowadays when we have all this screen time and Zoom classes. And so I tell patients, like, please have them, like, if they're on the computer, at least get up once an hour, walk around and drink your fluids and do a little bit of yoga, downward dog or something like that, and then come back to it, because we want to be able to enact that, or like just put more movement into our life, going outside and getting sunshine. Other than that, I think that mental health is also very important for children. We think that from just childhood, like all of a sudden one day they'll be an adult, and then you can treat them differently. But it, like there has to be a continuum of how patients grow up and understand the world. How parents show them the world in childhood is how they'll experience it in adulthood. A lot of the times I see children suppress their emotions, have underlying anxiety and depression, and the vagus nerve, goes from the brain all the way into the abdomen, and you hold a lot of tension and emotion. And when you say you have butterflies, like, they are real responses to how you emotionally feel. And so teaching children how to handle their emotions, how to deal with stress, is also an important aspect of not only gut health, but overall health.
Yeah. And I love that you're speaking my love language, because I'm like a polyvagal nerd. Okay. The vagus nerve is like the most interesting and most dynamic thing in our body, I feel like. And a lot of the kids that I see, so I see kids from as young as 2 all the way to 17. And so we hold trauma also too in our pelvic floor. So most of the kids that I'm seeing who are having toileting and bowel and bladder issues, their pelvic floors are so tense because there has been some trauma or some associated feelings of anxiety and fearfulness, whether that be through, toileting, withholding stool or urine, having bad potty training, potty learning experiences, sometimes sexual trauma, a variety of things that sometimes us as adults are like, hey, that's no big deal. Like, you had that didn't seem like a scary bathroom, but like to them it was traumatic. And so they hold that, and they hold it in their pelvic floor, and then their vagus nerve is not able to get those massages that it needs to release that. But also too, it's also connected to the diaphragm in the way that they are breathing. The diaphragm and the pelvic floor work synergistically. They have to move, and they have to work together as friends to be able to be used optimally to void. And so this is the big part of like what I do in my practice is I evaluate that, like how is the diaphragm moving? And too, through your visceral work, your hand manual work, that there are ways to release the diaphragm. And most of these kids that are chronically constipated, that poop is pushing up into their diaphragm. They have anxiety, they have all these things. And they can elicit a good belly breath, and you need to have that intra-abdominal pressure to be able to void. So this is what I teach in my practice, and we do it through different types of holistic and integrative approaches like mindfulness, yoga. I use animal-assisted interventions. I use aromatherapy. There's all these different things that I utilize to get kids to functionally be able to do this. They're not mini adults, right? So I can't be like, all right, Jenny, today you're going to take a big inhalation into your belly and release it. Like, no, we have to do it through play. We have to do it through a developmental process by which they can understand. So I think, like you were talking about earlier, there's different ways that us as a team in healthcare can really support these kids versus just one modality of like medication, which most of the families that I see that land in my care, that's the only option that they've ever been told about for their child. So pelvic floor therapy is essential for these kids. And I hope that it's part of, and like my husband's always like, oh my gosh, you're just like, you always have these like grand and crazy ideas, but I'm like, I hope it is definitely something that it's part of the well child visits, that there's questions about it that family providers can screen for, because often families won't bring it up because they're ashamed, or they hear that like, oh, your child will outgrow it, or, it's going to be fine. But really, like, there's a big chunk of families who feel like they shouldn't bring that up in some of these well child visits. So I think it'd be really nice to have like a little bit of a just quick conversation, like, oh, is your child stooling this much? Oh, like, are they holding? See a pelvic floor therapist. Like, I'd be like, that's a win for me, even if it's just one like provider like yourself, like saying, oh, go and see that person. That's more than what's happening these days. So, and I made a checklist actually out of my many years of practice, because what I'm finding as an OT with a sensory background, there are specific observable behaviors that I'm seeing in kids who have sensory differences in all 8 areas of the sensory system. So that screening tool, that checklist, could be one of the pieces of paper that these families get in their well child visits to be like, hey, as part of like your intake anyway, you just check it off.
Can you talk about those things? Like, tell us about that.
Yeah. So it's actually the 8 systems are our vestibular system, our proprioceptive system, our interoception system, olfactory, the way we smell, visual, tactile, the way we taste, and then our, what was it? Vestibular. There's one more I'm missing. Usually there's 7, but there's 8. The other system, it'll come back to me. But anyway, it's something that they'll have descriptions like, my child never feels the urge to go to the bathroom. My child is falling off the toilet. My child covers his ears in a public restroom. So there's all these different observable things. And I have this checklist on my website that people can download. And when you check it off, if your child scores 15 or more, that's a referral to go see an OT for a, sensory evaluation, because when those things are worked on, kids can have better outcomes with their toileting. So that's what I've been finding in my practice. So that's just a little aside, but that's a little bit for your followers here who don't know that much about occupational therapy and the sensory system. That's wonderful. The website, let me put that in the chat for you.
Hold on, let me see if I can pull up into the screen.
Oh, yeah.
Let's see. Is this your website?
Yes, it is. And then you can go to services at the top for therapists, courses and trainings. and there's the checklist. So you just put your name in and you can get your email, and that gives you an idea of a little bit about the sensory system and then what I've found in my practice. And it's wonderful because a lot of providers, you know, like you said, you don't have time to like ask all these questions.
Mm-hmm.
But if a family has a checklist like this, you can be like, hey, fill this out. Oh, it looks like you checked a lot off. Maybe here's a referral to go see an OT. Yeah.
Yeah, definitely something that I talk to my patients about, like, how many times do you stool? I actually asked the kid and they're pretty embarrassed to tell me. I'm just like, so how often do you poop? And then they'll just start giggling. I was like, what does your poop look like? And then they'll be like, what is she talking about? And then I'll ask the parents and they're like, oh, we don't really know because, you know, the kids sometimes go on their own.
Mm-hmm.
And sometimes like I'll do my exam and I'm just like, oh man, I feel a really big stool burden here. And so you may have some constipation issues.
Yes. And I love that you're asking the child, right? And so it is absolutely realistic for kids when they get older for parents to not know anymore. They think like, oh yeah, like, you know, Jenny's going by herself. She's like 7. She can do it. She tells me she poops every day, but they don't know it's those little pellets and those little rabbit pellets, those hard single poops. That's constipation. And so they don't really know that. And that's why it's a really good conversation to start having when kids are starting the potty learning process, to have that as a habit to look at the poop. And I have a Bristol stool scale. So I have this little guy with like all the different poos. And I started with my toddler. What does your poop look like today, sweetie? Mommy, it looks like a sausage. Yay. That means your body is healthy. It's having enough water. It's eating enough like fruits and vegetables. Wonderful. Oh, today it looks like number 2 bunches of grapes. Oh, what does that mean? Oh, you didn't have enough water today. You need to have a little bit more. So it's a really wonderful way to get them to start understanding what their body is telling them, but how they can be the boss of their body and be able to have easeful, non-large and hard poops.
So we have a question here. Do you mind answering this?
Sure. So Rhonda, hello. Your question is, can you talk about encopresis? Yes, I can. Do you have all day? Just kidding. Briefly, I'll talk about encopresis. So for those of you who do not know what encopresis is, it is when there's an impacted hard stool in the rectum or the colon. So the end part, I'm going to show you my friend here. Okay, well, let me see. It's all backwards. If there's like a large stool, I can't. This thing drives me crazy, right? It's like backwards or forwards in terms of the camera. So this is the rectum where stool usually is. And so it can be impacted. Okay, let me go this way. Here in the descending colon, and it can get really hard and large based on a few things. Okay, I won't go into the details of what that could be. But then what happens is the liquid stool that continues to get digested, oh, thank you, Dr. Lay, you're wonderful, starts to seep out on the outside of that stool. So if you can bring up encopresis and show it on the diagram, that will be wonderful. Look at you, tech savvy doctor here, that it starts leaking.
Good picture.
Yeah, and so you can see that an accumulation of hard stool, the digestive system continues to digest food. Kids are still eating and they're continually eating, okay? And so that liquid stool starts seeping out of the rectum, and you'll start seeing smears or skid marks or some kind of pudding type of fecal matter on underwear, pull-ups, etc. You know that this is encopresis when it's continually happening, meaning that the child is frequently having this. It's not just they haven't wiped good enough. And then they're having the other symptoms, right, of a distended belly. Maybe they're talking about stomach aches. You're seeing that they're not stooling regularly. This is a red flag to get it assessed by a provider like Dr. Lay to say, hey, I'm noticing this. And typically these kids will have to have a clean out, a bowel clean out to get rid of that impacted stool and have that rectum emptied and get back to size. The issue with the rectum being stretched with encopresis is you lose sensation in the rectum, meaning the kids can't feel it. So when they're telling you, I really didn't know that this was happening, they're not lying. They really cannot feel it. And so it is our job to maintain an empty rectum. So an empty rectum with suppositories or enemas, if that's something that your provider and you are on board with, the use of oral stool softeners and stimulants. So sometimes kids who are holding need that stimulant like an X-Lax, which is Senicide, to be able to move the peristalsis and move that stool through and break through the withholding of the child clenching their pelvic floor and their external anal sphincter. Was that okay? I could go on and on, but that's just briefly what you need to know about encopresis. And you need to go and get that child cleaned out.
I've had patients who would have accidents and the parents would be very frustrated because they didn't understand that, my child is older, around 7, and why is this still happening? Like, why are they soiling themselves? And it becomes very embarrassing for not only the child, but for the parent. And you have to have a lot of re-education that this is not their fault. Do not shame them. That brings on a whole nother tub of issues.
Yeah, for sure. Oh, there's another question here. How about Epsom salt? Dr. Lay, do you want to talk about that?
I need to know more about the question. Like, what do you mean about Epsom salt? Do you do Epsom salt? Like, most of the time when I do Epsom salts, it's just Epsom salt baths for relaxation of like either the vagus nerve or the pelvic floor muscles. There are salt enemas, but you would have to, as I said, hold the enemas within the rectum for it to dissolve the stool. As I said, as you saw in the picture, it's that compacted stool that stays in there. And so squirting water up there is not going to just have it slide out. You really need to like keep it in there. It's more of like a soapy enema that we use.
Oh, she said as a laxative. Epsom salt
as a laxative. I've seen that used before. It really it stimulates the intestines and it really makes you go diarrhea like explosively. So it's sometimes not safe because we don't know how much to use. It's like drinking salt water. And you can just like lose too much in your system.
Yeah. I've never had any kids get recommended Epsom salt laxative. But Epsom salt, definitely, like Dr. Lay was talking about with baths, it's really nice too, just for the relaxation response. And then also the magnesium. Sometimes those, concoctions that you see have a little bit of magnesium. So it kind of gets into the pores, which is really nice. Rhonda has another question. Rhonda, full of questions here. How can OT help with encopresis? I love that. So OT, like I said, can specifically, if the OT is trained in pelvic floor therapy, which I will tell you, not a lot. So I'm a unicorn, okay? Not a lot of OTs know how to treat the pelvic floor. Historically, pediatric PTs have been treating this population of kids, but they're also unicorns, meaning that there's more pelvic floor therapists for adults, and they're even limited in, and they're very high in demand, but we're like the extra unicorn because we work with kids with pelvic floor. So that's very, very specialized. And in my practice, that's only what I see. I don't see the typical other clients that OTs see. Like they see kids who have fine motor delays or feeding challenges or coordination issues or oculomotor, like visual processing challenges, self-care challenges, all these types of things. But I'm very like specific because this is like my jam. I love working with this population. It's my passion. And how a pelvic floor therapist like myself, who's an OT, can help with encopresis is looking at how is the child's pelvic floor moving? Like I mentioned, how is their breath? How is the diaphragm moving? What is their strength? What is their ability to relax the pelvic floor? And then what are the underlying causes? If it's sensory, if it's a fear and anxiety problem with the actual process of defecating outside of the home, looking at nutrition, looking at fluid intake, looking at posture, and all these different types of aspects that we don't even consider when it's not something that we're challenged with, right? So if you think about it, you're not thinking, oh, I need to maintain a seated position on this toilet while I, press my abdominal muscles and relax my pelvic floor so my anus can relax. Like, you're not thinking about that. But these kids have to. They have to learn because there's a dysfunction there. And then we also work on, like I said, the sensory system. A lot of the kids that I see have an under-responsive, meaning their sensory system's not getting that strong signal to say that they have an urge to pee or poop, meaning that there's no strong urge to feel the poop in their rectum, or that their bladder is full. And sometimes it's over responsive, meaning that even if the bladder is a little bit filled, they feel like they have to go all the time. It's that urgency and that frequency. So we have to be really detectives about what exactly is going on. And then I look at the whole family. How do we implement this, and how do parents get this kind of mindfulness training? Because like Dr. Lay mentioned, they're like embarrassed. They're frustrated. They're overwhelmed. They don't know who else to turn to, if this problem's gonna resolve. And they're like very anxious themselves is what I've noticed. And so I incorporate that into my practice, is providing care to the families as well as to the child. So hopefully that was helpful and I answered your question, Rhonda. You can always reach out to me too on Instagram. Send me a DM, Aloha Integrative Therapy. Any other questions? Because I don't want to take Dr. Lay's time, okay? And I have to start seeing patients soon too. My goodness.
Yeah, I love that we're able to connect on here. As I said, I wish that we were able to spend more times with the families, and even teaching children how to breathe with their diaphragm, and spending that time, because really it's hard to think about breathing with your diaphragm. Some adults that I see don't breathe with their diaphragm. It's very shallow breathing. And then a lot of the times too, it's relaxation of the sphincter muscle. As you said, a lot of us, either it's too tight or too loose, and causes a lot of GI issues, like either they have diarrhea or constipation. And so I have a really hard time referring anybody to a pelvic floor person, because the waiting list is just so long.
Yeah. Yeah. And what's really nice about my practice is that I can see people who are all over the United States, and I do a parent coaching model with them. And then I try and link them up with someone who's close to their area if I feel like that child needs that in-person care, because sometimes they don't. Sometimes they're able to take the recommendations that I have, implement them, and the child gets better. Or I say, you're going to go to a pediatric GI doctor. Here are the top 3 questions you need to ask in your session, in your appointment, because this is the information that you need to know moving forward to help your child. And so I work on that kind of model for parent coaching. And then I also see people in person in my new clinic here in the Midwest. I'm located now in Fargo, North Dakota. And I still see OT clients from Hawaii and from California. So that's direct OT services. And the other, like I said, clients are coaching. And so if you guys are anytime looking for a therapist, I am happy to see if I could support you. And Dr. Lay, if there's any clients or patients of yours that you feel could get the support from my practice, please send them my way, and I would be happy to take care of them.
Thank you so much for reaching out. I really appreciate you spending your time.
Yes, of course. And we'll talk soon. Take good care.
Bye.
Okay, bye.